I talked to you about Artu. Artu is a cat, is this domestic short-hair castrated male, 12 years old, 6.4 kilograms. The history of Artu is that 6 months ago started having polyuria, polydipsia and also polyphagia. And the private vet, they diagnosed diabetes mellitus. And the cat was initially treated only with diet. They choose a diet high in fiber and also homeopathy, but it was not working. The cat was losing weight. The cat was a 10-kilo cat, now is 6.4, is lethargic. Therefore, the vet tried also an oral hypoglycemic agent, the glipizide, and gave just 1/3 of a tablet of 5 milligrams, so an underdose of the medication. And the cat was not doing well. And in the last 2 months, the cat is also walking not properly, has difficulties to stand, difficulties to walk. On the physical examination, the cat shows plantigrady, has a body condition score of 4 out of 9, so mild underweight, mildly underweight, and has a mild dehydration. In this video, I show you the gait of this cat. We see the classical plantigrady, which is a neuropathy related to diabetes mellitus that is under control, not well controlled. And this is quite typical of cats that are not well controlled with diabetes. Therefore, we wanted first to see if there was only diabetes or something else. We know that it's much more difficult to manage a diabetic animal when there is a concurrent disorder. So we started with a normal hematology initially and was unremarkable. Urinalysis was showing glycosuria, but fortunately high urine-specific gravity of the urine and no ketone bodies. So it was like a classical diabetic cat. On biochemistry was evident an increase in the transaminase, mild increase in albumin, so mild dehydration, and fructosamine and glucose were extremely elevated, and it was fitting with the diagnosis of a diabetes not controlled. We decided to do a bit more workup. We tested the total T4 that was within the reference ranges, so no hyperthyroidism. And also X-rays, we see mild hepatomegaly, and we perform also abdominal ultrasonography. There were mild degeneration of the kidneys, a bit of sludge in the gut bladder, but otherwise the abdominal ultrasonography was unremarkable. So we decided that we had a cat with diabetes mellitus. At this stage, probably only diabetes. We should perform an appropriate treatment. When we perform a treatment, I want to stress the fact that we have to follow the rules, follow the guidelines, because sometimes I see a lot of, I would say, fantasy in treating and imagination in treating diabetes mellitus. We know that there are specific guidelines. We have article, consensus statement, and textbook where we can find the guidelines to treat cats with diabetes mellitus. So what I did, I simply applied the rules of treating cats with diabetes. So for example, if we look at the Animal Hospital Association guidelines for dogs and diabetic dogs and cats, we read that in cats, the initial approach to manage a diabetic cat is to give an insulin injection. Usually we use the insulin analog glargine or the PZI. These are two first-line insulin for cats. They are long-acting insulin, and usually we start with 1 or 2 units per cat every 12 hours. So very important, the insulin as a first treatment option. Together with the insulin, we should change the diet and give an appropriate diet. Usually in cats, we want a high protein diet. It means that more than 40% of metabolizable energy should come from proteins. And this is very important to maximize the metabolic rate, to limit the danger for developing lipidosis, and to prevent muscle loss. This is very important. And another very relevant aspect that a diet for a diabetic cat must be very low in carbohydrate. And it is known today that this is the combination of the perfect diet for cat. Very high in protein, very low in carbohydrates. Therefore, this is what we decided to do. We started with glargine, 1 unit 2 times per day, injected subcutaneously. And we started with a commercial diet, very high in protein and very low in carbohydrate, which is the DM Purina. And we explained everything to the owner, and we sent the cat home, and we discussed to the owner all the aspects related to diabetes, and we asked the owner, please come again here for a re-evaluation in 1 week. After 1 week, the owner was quite happy because since month the cat was very bad, now was much better, was more active. He started again playing a bit. The cat has still a bit of polyuria and polydipsia, but was better. And the body weight was stable, was 6.4, now is 6.5, so a bit better. And also the fructosamine are now lower. They were 744, now 587, so a bit better. We perform a blood glucose curve in the clinic, and here you can see the values, the glucose values in this cat. In the blue area are the values that we would like to have, so between 90 and 250 milligram per deciliter. And we see that most of the values are above this value. So the glucose value are still a bit elevated, so we decided to increase the insulin dose. We were giving 1 unit 2 times per day, now we started 1.5 units 2 times per day. It is important to increase the dose just of half a unit, not more. So we asked the owner to come back in 2 weeks, and the cat was doing better, was active. The plantigrade was still present, but the polyuria and polydipsia was decreased, and also now is eating a bit less, is not so much polyphagic. The body weight is increasing and the fructosamine are decreasing. They were 587, now 354. And also when we perform a blood glucose curve, just after 2 weeks of insulin, when we started the insulin treatment, we see that all blood glucose values are quite low, and some values are also below 90 milligram per deciliter. So we decided to reduce a bit the dose. We was receiving 1.5 unit. We decided to decrease a bit the dose. So we re-evaluated the cat after 4 weeks. The cat was active and walking much more better. No polyuria and polydipsia was present. The polyphagia was much less. The body weight was increasing, and the fructosamine were almost normal. And also the blood glucose curve was really good with all the values in the normal glycemic range. Probably too low for a diabetic cat. Therefore, the cat was receiving 1 unit 2 times per day. We decided to reduce the dose to half a unit 2 times per day. After 6 weeks after starting the insulin treatment, the cat is doing very well. Is active, is walking much better, has no polyuria and polydipsia. The appetite is normal, the body weight is stable, the fructosamine is fine, and also the glucose value are absolutely good. Therefore, the cat is receiving half a unit 2 times per day. We decided to stop the insulin. This is probably a remission of the cat. But of course, we re-evaluated the cat without insulin. After 12 weeks after starting the insulin initially, the cat is doing really well. The owner is happy, no polyuria and polydipsia. The body weight is 8.2 kilograms, the fructosamine are fine. All the glucose values are normal, and this cat in this moment is not receiving insulin. Therefore, we consider this cat in remission. And so usually when a cat goes into remission, we ask the owner to monitor the glycosuria in the urine. If there is persistent absence of glycosuria, the cat is in remission, because it is usually to check the glycosuria, because if glycosuria appears again, usually it appears before the appearance of the clinical signs. And in these cases, we don't give insulin anymore, but we continue with the diet, because it's important to go on with a diet low in carbohydrate and high in protein. And to conclude, I want to tell a few words about the remission in cats. A recent study performed in the United Kingdom observed a remission rate of 13%, but this was a number obtained from a lot of animals treated in different ways, not with the same protocol. From cats that are treated in specific studies, the remission rate is reported up to 60%, which is extremely high. Probably this is too much. Probably a more realistic percentage is between 30 and 40%. So, of course, if we treat our cats with the appropriate diet, the appropriate food, the appropriate monitoring. But today, fortunately, we can do a lot for our diabetic cats.